What's the plan today? What is the flight plan? Okay, so CHF. In other words, congestive heart failure. The flight plan is, first of all, we're going to define CHF. Second, and I don't know if this order is right. We'll see. I'm playing with it, but let's see. God bless you. Then what we're going to, there are different ways how you can divide the congestive heart failure. So first, I'm going to try to divide it onto systolic and diastolic dysfunction. Systolic versus diastolic dysfunction. Okay, and there are more ways. So of course, I'm going to mention them as well because they're very important. Another way how you can divide it is, and it's basically the same, but it's called heart failure with reduced ejection fraction versus heart failure with preserved ejection fraction. Okay, so we're going to deal with that. Then what I'm going to do, and I guess this is better, we're going to go through the symptoms and signs of it. Okay, so symptoms and signs. And signs, but also maybe diagnostics. So different diagnostic procedures or markers you look for when you look for congestive heart failure, okay? And then I'm going to try to still divide it onto acute and chronic congestive heart failure, okay? Then we're going to go for causes. And there's going to be an important term that I want you to remember, or two terms. One is remodeling, so remodeling, and the other one is cardiomyopathy. Okay. 7, that's going to be a table where I'm going to try to sort out a different stages. So it's going to be a table where I will try to distinguish the differences between cardiac output and maybe stagnation or whatever. So let's name it the dry and wet plus cold and warm table. And according to this table, and not only that, but according to this table, I'm going to try to give you a taste of therapy. Okay, so the way the therapeutic approaches and how much these therapeutic approaches differ, because they differ a lot. They differ if it's acute or chronic, and also depends on the level of cardiac output and the stagnation of the blood, etc. So there are differences. Okay, so therapy. But we're going to talk about therapy, I guess, all the time because it's crucial and it's going to be just a small taste of it, okay? Good. So, how would you define congestive heart failure? What is that? What is that? What do you think? What is it? So it's a problem of the heart as a pump, and there are more ways how to look at it, okay? But the important thing is that the pump is not working as it should be. But within failure, we already talk of failure that somehow it's broken the pump, but still is able, thanks to compensatory mechanism, sort of work. But it's starting to be overloaded, okay? So basically, the thing is that heart failure means that the heart is not able to support the peripheral tissues with proper perfusion, and etc. Or the fillings of the heart are already increased. The filling pressures are already increased, okay? So once the filling pressures are increased, it's already telling you, hey, the heart is more stretched out and it starts to fail. And when it severely fails at the end, it's going to decrease the perfusion of the periphery. The cardiac output is going to be decreased with all its consequences. And we're going to talk about that. So very simply, the pump is failing, but even before you will see it in the cardiac output decreased, still it could be normal, but you will see that the fillings are increased, the pressures, and once the pressures are increased, it's already considered as heart failure. And congestive means what? Congestive means that the blood gets stuck. And because we got two hearts, we got a right and left heart, then it depends where it gets stuck. But by the way, the most common, and the thing, first of all, I want you to see and imagine if I say heart failure, I mean the left heart, which is the most common one. That's the one that works the most. It's to fight the systemic resistance, and it's the one that fails the most commonly, the most, okay? And basically, if the left heart is going to fail, where will the blood be stagnating or congested? In the lungs. So, and we're coming to the first symptom. We're going to go through it later. But again, if I say congestive heart failure, and if I'll be more specific, and I will specifically ask for left heart, the main symptom is, okay, but symptom would be trouble breathing, or in other words, dyspnea. Very good. So air hunger, dyspnea. That's typical. That's so typical. But there are so many causes of dyspnea. I'm going to specify this later more. Okay, there are many. What other causes of dyspnea? Anything. Every time you're sort of having air hunger, so it could be asthmatic attack, it could be pneumonia, whatever. But there are specific things you can look for to guess it's rather due to left heart failure. In left heart failure, it's going to be congested in the lungs. If it's right heart failure, so it's going to be veins. So liver, exactly. You're going to have hepatomegaly, and you're going to have swollen ankles, and you're going to have JVD, ventricular venous distension. But before we get over here, and there are some connections between this. Again, back to left heart failure, the most common one. And by the way, heart failure is the most common reason why people come, at least what some statistics say, come to the hospital for hospitalization, congestive heart failure, okay? Anyways, so how the left and right heart are combined. So most cases, I don't want to be kidding, but let's say 60, 70% are, and I'm just making up the numbers, but it's somehow like this, okay? It depends, of course, where. But the left heart failure, it's the most common one. Let's say 60%, 70. Yeah. Compared to this, solitary right heart failure, it's very unusual. I would say like 10%, okay? And can you tell me a only right heart failure cause? What could that be? Well, then it won't be only right heart failure. So only. What? Okay, that's a magic word, genetic disease. You're right, of course, but something what is common. So how could I fail with the right heart? Pretty fast, maybe. Pulmonary embolism, exactly. Very good. That will be acute failure. If it's severe, it's going to be acute. So, for example, pulmonary or something else. So basically, I want to keep my left heart okay, but right heart is going to have a problem only. And what's between right and left ventricle?
The thickness of the wall.
Okay, that's anatomically, and let's say virtually in the terms of flow. What's between the right and left ventricle, or right and left atrium, if you want to be? Lungs. So anything with lungs, I'm talking about COPD, I'm talking about ARDS, I'm talking about restrictive diseases. So if there's something with lungs, if there is a fibrosis, or as we said, COPD, so chronic bronchitis or emphysema, it's harder for the right heart to pump through the lungs, the blood. So of course there's going to be pulmonary hypertension, and this will sooner or later lead to congestive right heart failure, okay? So that would be like single only right heart failure. It's less common, definitely less common. The one you will see is left heart failure, most commonly. But yeah, we said it already. Of course, you're going to typically see it in a package, because typically when I fail with the left heart, and it's not 100%, but at least 30, 40%, if I'm failing with the left heart, sooner or later, depends on the medication. But if I'm failing with the left heart seriously, and I'm not on medication, I'm not treating anywhere, they say in half year about, I will start to fail on the right heart, okay? Because first I'm going to lung edema, but it's going to worsen, then the right ventricle has to work against that, and I'm going to fail with the right heart. So both ventricles will start to fail, okay? But it's not 100%. And by the way, the most common cause of right heart failure is the left heart failure. Okay, so it starts with left, but depends on the medication. Many people will survive without if they're well treated, and it depends on what type. I will already tell you, maybe now, we're mainly talking about dilated left heart. So with a systolic dysfunction. That's the one you should imagine. And this one is also sort of, it's more dangerous in a way, but it's also well treated. If you use the proper medication, you can even reverse the prognosis and whatever. So many people can survive for many years if they're having a systolic dysfunction, most common one, systolic dysfunction of the left heart, most common one. Then with good treatment, you can survive pretty long, okay? And the treatment can improve. And that's a big contrast, for example, towards the diastolic dysfunction, where the treatment is only like symptomatic. It won't reverse anything, but it will improve the life. So that's one comment in advance before we get there to the treatment. So basically, what I want you to understand is there are many like flavors of the congestive heart failure. It also divides on right, left, and whatever, but the one you're going to meet the most commonly is the systolic dysfunction, and it's the left heart. But still, the definition of the congestive heart failure, or the thing you should realize, it's a syndrome. It's not a specific thing. Many heart diseases, many, end with congestive heart failure. So there are many causes which will lead to one thing, and that's congestive heart failure. What is actually congestive heart failure? It's a group of signs and symptoms that typically are seen during heart failure. So, and what is systolic and diastolic dysfunction? So what's the difference? What do you think? So what's the difference? Where's the problem?
So if the heart cannot pump the blood outside, maybe because of many reasons, and diastolic maybe have problems with giving.
Exactly. Or in a way, the systolic problem is this problem or dysfunction of the contraction. So it's weaker. The muscle is weaker. And typically, most commonly, it's dilated. So whatever reason or whatever cause it was, it's harder to contract for the heart. It's weak. So it's dilated, typically. And that's why the end diastolic volume is increased. And also end systolic volume is because it's dilated more, but it's not able to pump out as normally as it would. Okay, so it pumps less blood. So systolic dysfunction, it's a problem of the muscle, and there's a problem with contraction. With diastolic dysfunction, it means it's not able to relax. So typically you got two scenarios over here. With systolic, mainly you should imagine a dilated heart. It's dilated over here, so this is the left ventricle, and it's longer a bit. And there are thicker places and also thinner places of the heart. It depends. In contrast to the diastolic dysfunction, over there are many causes or examples, but I want you to remember two over here. One of them is when there is a hypertrophy of the, now let's say, left ventricle. So the muscle gets thicker. It's thicker than usually. And that's why the volume inside is decreased. So this is pretty powerful in squeezing, but it's not able to relax. So the end diastolic volume is smaller. And the same accounts with a restriction. And in this case, the heart, and it's again diastolic dysfunction. This muscle is not thicker. It could be a bit thicker, but it could be normal. But it's not having problem with the thickness of the wall. Maybe I should decrease the volume here. But it's not able to relax. So this one is hypertrophic heart. Hypertrophic. This one is restrictive. So over here, although the thickness of the wall is normal, the volume, the end diastolic volume is decreased because it's not able to relax as normal. So the compliance is worse. Okay? So it's not as elastic. Okay? So in systolic dysfunction, you should rather imagine a heart that is dilated and weak. On the other two cases, that it's not able to open as much. And this is in relation with the ejection fraction over here, because ejection fraction, it's a percentage. Okay, a normal heart should eject over 55% of the volume, of the end diastolic volume. So I'm going to get some volume at the end of the diastole as I'm filled as much, and then I should eject more than half of it, 55 to 70%. Okay, and guess which one is not able to get rid of more than half? The one that is dilated. So this is very much a sort of a synonym. There could be some differences, but it is a synonym. So the systolic dysfunction mean it's a heart failure with reduced ejection fraction. And typically reduced means below 40. So in this case, it's below 40. Okay, so it's smaller than 40%. 35, 30, yeah? In contrast to this, preserved ejection fraction, that means it's over 50%, is in the cases of hypertrophy. So if it's a hypertrophic heart or if it's restrictive heart, okay? In this case, you're going to eject more than 50%. But it's percents. No one said that the stroke volume is not decreased, okay? It's percent. I'm able to get rid of more than 50% of the end diastolic volume, okay? Of course, if the ejection fraction is between 41 to 49, it's sort of a combined problem, okay? But I don't want to get into that. So that's what you should know, the difference between the restrictive or hypertrophic heart and a dilated heart, okay? Good. So, thanks for watching, and don't forget to subscribe and ring that bell. And as always, check the description below for supplementary questions and other materials.